What is an aortic valve replacement? Why is aortic valve replacement necessary? Is it possible to repair your aortic valve? How is aortic valve replacement performed? And what's the recovery process like? I am Jorge Mascaro, consultant cardiothoracic surgeon at the Priory Hospital here in Birmingham, part of Circle Health Group, the largest private healthcare provider in the UK with over 50 hospitals across the country. Today, I'll be answering some of your most frequently asked questions about aortic valve replacement, including how to prepare for the surgery, the types of aortic valve replacements that are available, and how to take care of yourself after surgery. So, without further ado, let's begin the video. What is aortic valve replacement? Your aortic valve is like the gateway between your heart and the main artery that carries blood to your body. Sometimes this aortic valve might become narrowed, known as aortic stenosis, or start leaking, known as aortic regurgitation, making it tough for your heart to pump blood efficiently. That's where aortic valve replacement comes into play and can really help. Aortic valve replacement is a type of surgery that aims to replace your worn-out aortic valve with a new prosthetic one. There are two options for the new valve: mechanical ones made from sturdy materials, or biological ones crafted from animal or human tissue. The best choice for you depends on factors like your age and lifestyle, and your consultant surgeon will ensure you get the best type of valve for your personal circumstances. The surgery itself can be performed in a couple of ways. Your consultant might need to make a large incision in your chest in order to use traditional open heart surgery, or they might be able to use a smaller incision and perform the operation using a less invasive approach, where they use very small surgical tools to perform the procedure. This option has the benefit of a faster recovery time, but it is not possible in all cases. After the surgery, there's a bit of a recovery time involved. You likely spend some days in the hospital, then gradually ease back into your usual activities while keeping an eye on things during regular follow-up visits. The key is to give your heart a chance to heal and get used to its new valve. Why is aortic valve replacement necessary? Damage to the aortic valve can develop due to many reasons, such as age-related degeneration, inflammation, or infection. When your valve doesn't open and close as it should, it can lead to reduced blood flow, causing symptoms like shortness of breath, fatigue, chest pain, and even heart failure. Aortic valve replacement helps restore normal blood flow, relieving you of these unpleasant symptoms and improving your overall heart function and general health. It's worth mentioning that you don't always need aortic valve replacement. If you're young and the valve is incompetent, which essentially is when there is a small leak due to the frame of the valve, the annulus, being enlarged, it's possible to add support to the outside of the valve, which reinforces this frame. Unfortunately, if you have damage to the leaflets, to the flaps, you'll need a replacement. What types of aortic valves are available? As I mentioned, there are two common types of aortic valves used in replacement procedures: mechanical valves and biological tissue valves. The mechanical valves are usually made of very strong and durable material like metal or carbon, and they tend to last longer. However, they require lifelong blood thinning medication to prevent blood clots forming on the valve. Biological tissue valves, on the other hand, are usually made from animal tissues, either bovine or porcine, or in some rare cases, a human donated valve. They don't usually require long-term blood thinning medication, but they may need to be replaced after a certain number of years. Together with your consultant, you will decide which option is best for you depending on your age, lifestyle and general health, and your reason for having an aortic valve replacement in the first instance. How do I prepare for aortic valve replacement? Preparing for surgery involves several steps. Your consultant will take you through an in-depth evaluation, including physical exams, imaging, blood tests, and other lab work. You may need to adjust or discontinue certain medications, particularly those that affect blood clotting. You'll have plenty of time to have open conversations with your healthcare team, any questions, and discuss any concerns you may have before surgery. Drawing on your support system of family and friends can also make the process smoother. Either way, your team will always be there to answer any questions you have about how to prepare for surgery in the safest way possible. How is aortic valve replacement performed? Aortic valve replacement can be performed either through conventional open heart surgery or using minimally invasive techniques. Open heart surgery has been performed successfully for decades with valves that have long-term resilience, so this surgery is the most common. In this technique, an incision is made along your chest and your heart is temporarily stopped while a heart-lung machine maintains blood circulation. The damaged valve is then removed and the new valve is carefully sewn in place. Less invasive techniques include a smaller incision known as minimally invasive procedures. The valve that is replaced is exactly the same as in conventional heart surgery. Another less invasive technique is TAVI, the transcatheter aortic valve implantation. If you are much older or higher risk, this may be the suggested procedure. The TAVI method is very different. A catheter is threaded through a large blood vessel that runs from your groin up to your heart. The new valve is then positioned and expanded within the old valve. The type of surgery you have and the technique your consultant uses will depend on the severity of your condition and your individual circumstances. The final treatment choices will be decided ahead of time, and we would discuss everything with you in detail so you understand exactly what to expect. What's the recovery process like? Recovery after aortic valve replacement varies depending on the approach used, as well as factors individual to you. After conventional open heart surgery, your time in hospital is usually around a week, followed by the period of gradual recovery at home. You'll need to follow your consultant's instructions, which may include taking prescribed medications and only engaging in light, low-impact activity. With minimally invasive techniques like TAVI, hospital stays are usually shorter and your recovery tends to be quicker. Whichever type of surgery you have, it's important to give your body time to heal. You'll have more than one follow-up appointment with your consultant who will speak to you about progress and scan the heart to check recovery. Your consultant will make sure you have knowledge of an accurate, detailed recovery timeline based on your individual circumstances. What kind of exercise can you do after an aortic valve replacement? After an aortic valve replacement, your exercise plan will depend on factors such as your overall health, the type of surgery you had, and how far along you are in your recovery. It's not only your heart that needs to heal, it's often the incision through the breastbone that needs a little longer and some extra care taken. I'll talk you through some of general guidelines around rehabilitation. Walking is often one of the safest and most recommended forms of exercise after surgery. Start with short, gentle walks and gradually increase your distance and intensity as your stamina improves. Cardiovascular exercise. Once approved by your consultant, you may be able to engage in low-impact cardiovascular exercises such as stationary cycling or swimming. These activities can help improve cardiovascular fitness without putting excessive strain on your heart. Strength training, light resistant exercises with low weights or resistant bands can help maintain muscle tone and overall strength. However, it's crucial to avoid heavy lifting or straining, especially in the early stages of recovery. Gentle stretching and flexibility exercises can help maintain joint mobility and prevent muscle stiffness. Yoga or Tai Chi may be suitable options, but discuss it with your consultant before starting. Breathing exercises can be beneficial for improving lung function and promoting relaxation. Your healthcare provider or a physical therapist may provide guidance on appropriate techniques. What are the risks and complications of surgery? As with any surgical procedure, aortic valve replacement comes with potential risks and complications. These can include bleeding, infection, irregular heart rhythm, blood clots, and adverse reactions to anesthesia. Of course, in such complex surgery, the biggest risks, which are rare, would be stroke or mortality. This is your heart after all. Mechanical valves may mean that you need to take blood thinning medications for the rest of your life, which can increase the risk of bleeding. Biological tissue valves, while not requiring lifelong blood thinners, may need to be replaced after a certain amount of time. Your consultant will talk you through everything and assure you that these risks are not very common. You'll be in very safe hands with your healthcare team throughout your journey in hospital and afterwards. It's just important to know the risk of surgery before having it. Can lifestyle changes help after aortic valve replacement? Absolutely. Aortic valve replacement will improve your quality of life. Adopting a healthier lifestyle after surgery will significantly enhance this long-term success. This includes maintaining a balanced diet, engaging in regular exercise as recommended by your consultant, managing stress, and avoiding tobacco and excessive alcohol consumption. Follow your consultant's guidance on medications and attend all follow-up appointments to monitor your heart's health. Remember, a healthy lifestyle can greatly enhance the benefits of the procedure. What is life like after surgery? You can absolutely lead a happy, normal, healthy life after recovering from surgery. Living a healthy lifestyle is important with the right balance of exercise and diet, but this can be easily managed with the help and guidance of your healthcare team, who will ensure you have all the information you need to protect your new valve for years to come. So, there you have it. Some of the most commonly asked questions about aortic valve replacement, including how it is performed, what the recovery process is like, and lifestyle changes you can adopt to keep healthy and support your recovery after surgery. I hope this video has provided you with some insight into the procedure and what to expect. If you are in need of an aortic valve replacement, remember that your healthcare team is here to support you every step of the way. If you want to come and see me for a consultation to talk through your options for treatment or discuss any heart issues you have, then you can book online via the link in the description below, or alternatively, search for your nearest Circle Health Group hospital and the next available consultant in your area at circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, please comment below, as we'd love to hear from you. Otherwise, thanks for watching.